Last week, we talked about weight loss with some of the newest medications that are out there. Lots of questions with our patient base with semaglutide, Wegovy, Ozempic, Monjouro. And Natalie, can I kind of share a little bit about what we learned last week about what do you do once you stop these medications and you have elasticity on the arms and maybe the legs?
Well, you should have worked in a little bit of exercise going into
Right.
it. Yeah,
So
so
that's
you have to give yourself a little oomph to keep going.
Yes. So that's one of the things we're going to talk about today is what you need to do while you're taking the medication and when you wean from the medication, or maybe you'll stay at a small dose during that time. So listen up today as Denali, Dr. Denali joins us as well.
She
Have a blessed
agrees.
one. Talk to you soon. Welcome back to Everyday Health Hacker with Natalie Moser and Dr. Liza Leal. We're here with you today for Meridian Medical Dental Health Care, powered by Meridian Health Institute. Welcome back, Natalie.
Hi, how are you?
Doing great. So
Good.
share with me. Last week we talked about semaglutide, Monjouro, Wegovy, Ozempic, all these questions that we've been bombarded with through email. So thank you, everyone, for calling and reaching out as well. And share with us some of the questions that you found that were a little different this past week.
So some interesting things I have gotten is, if I lose a whole bunch of weight and, because
Which is the goal, to lose
which
the weight.
is the weight.
Yeah.
People want to know, am I going to get skin laxity? When I stop taking it, am I going to gain all this weight back?
So yes, one of the patients, I remember, one of the things that I like to do is I like to measure their arms, measure their thighs. And then when they have the skin elasticity, it's like, are you working out? Are you taking collagen? And we see a huge benefit because they don't get that crepiness.
Right.
And if you're, I'm just going to say over 40, but some of us are really over 50, is that, crepiness kind of sets in.
It
And when
does.
you're trying to lose
It
weight,
does.
you really want to avoid that because we like that plump looking, makes us look a little younger. Share with us, some of the results that patients have found this past week.
It's kind of interesting. They've had friends that have been on it. Some have lost, 8 to 10 pounds in a week. We've had some patients have astronomical weight loss at 40 pounds in a month, which is
Yes.
fast.
It's fast.
Very, very fast.
Which we have to be cautious with, right?
They all want to know, almost everyone wants to know, is it going to drop my blood sugar? Am I going to feel dizzy and weak?
Which
And
can happen.
It can. It can happen because you're stemming back your appetite.
Right.
So you have to eat smaller meals several times a day, and then they hear about Ozempic face and,
Yes.
am I going to get that drawn look? And,
Yes. And you're in the right place here
Yeah.
at Meridian because we can help with that. We do oral therapy, which will
Right.
help to tighten and lift the face. So
Right.
there's a lot of things, people always talk about, I want to lose weight. I want to go from 180 to 140. Well, those 40 pounds, when you lose that, that's a shock to the skin. And,
Sure.
the skin is your largest organ in your entire body. So, you have to be very mindful of that. It's not just putting lotion, but it's also feeding your body the collagen. And a lot of people will say that I've heard from patients is that, that first week or two, I was a little bit nauseous and then the nausea goes away and they stop eating. However, they lose a lot of the benefits of staying consistent on the meal plan.
Right.
So
right.
how do you kind of advise them about what to do for breakfast, lunch, and dinner?
Well, and here at Meridian, we're not just going to give it to you and send you on your way. There is some education that goes behind it, and we want you to check in with us every month so we, can basically follow you through the whole process. So, basically because it slows down your digestion rate is why you're not hungry. So you want to be sure that you're staying away from very sugary, greasy, fatty foods because it sits on top of your stomach and that's what causes the nausea. So we kind of give you a guide of doing lean, healthy protein, making sure you get enough protein in during the day, water, unsweetened tea, just giving you the tools that you need to be
Right.
successful, so that we're kind of guiding you and giving you the comfort of knowing if you have a question, it's okay to ask,
It's
because
okay to ask.
everyone's going to have questions.
Yes, ask, text, send us an email, because we're here to be able to help.
Right.
And, one of the things that I find, I like to have patients give me not an everyday diary, but
Sure.
maybe 2 or 3 days out of the week, because maybe they've hit just kind of hit the wall of, this just isn't as easy as I thought it was going to be. And those
Correct.
are usually the people that have not changed their nutritional plan.
Exactly.
So I'll get to exercise in a minute, but when you don't change your nutritional plan, a lot of times when that food is sitting on your gut, well, it's got to get rid of, your body's got to get rid of it some way.
That's
and
right.
then you're going to end up with diarrhea, because the body just goes through an osmotic diuresis, which means I'm going to clean you out because this cannot stay here. And the medication is helping to prevent you from desiring to want to eat.
Exactly.
So that's also very helpful. And I always say that there's got to be another mechanism in the brain that works on that satiety, where it makes you feel full.
Well, and the goal too is that we're hoping by when you do get to your goal is that by then you've learned, right? You don't have to finish everything on your plate. You can eat smaller portions and healthier things. And the one way that these medications are, with studies saying that they work is it does lower your cravings.
Right.
And so something that you craved all the time before, even once you're done with the medication, you probably won't crave it any longer.
And there's a lot of women and men that say, I'm doing so good on this and I've lost all this weight. Can I just stay on it? And what do we say?
Well, I mean, it's a lifestyle change,
Correct.
like anything else, and you don't want to take medication that you don't necessarily need.
Right.
And we are blessed to have something like this because it's not a stimulant. It's not a controlled substance like everything before. Everybody's like, is it similar to Fen-Phen, way back then when
And
it
it's
caused
not.
all the cardiac problems and pulmonary problems. And it's not. And, you have to have the right mindset to do it. Because I also get the question, I don't think I can give myself an injection, and we're going to get that a lot.
Right.
But we can help with that too.
Yeah.
So
We have several medical assistants here that can also, you can stop by and we can get you taken care of, because that can be a little overwhelming if
Sure,
you've never done
sure,
that
of
before.
course.
And we'll be having a teach little TikTok soon about just how to do it to make you comfortable, because it is really super simple. And sometimes you might practice on an orange or something so that you can practice, maybe not with the medication, with just maybe saline, so that you get comfort level.
Right.
And then we'll teach you a couple of tricks of the trade so that it's comfortable to
and
be
you
able
can
to
also
do.
bring somebody with you if you
Yes.
absolutely feel like you need someone to do it for you. We can teach someone else too.
Right. And we have a lot of husbands and wives that come together because
the time.
they're helping each other and they're very supportive of each other. And it also becomes, a little on the competitive side about who's doing what. So that's also a lot of fun.
Yeah. And we get a lot of, I have gotten a lot of questions, especially in this last week. So does that mean I can't go out to eat anymore? And you can. You just have, like I said, it's an educational process. You have to be in the right mindset. And throughout the process of, quickly seeing the weight come off for the first time ever, we want to educate you and teach you so you know what to order.
So if you're going out to a Tex-Mex, you might put the chips on the opposite side of the table.
Exactly.
And maybe order an avocado so that that's going to be better filling and better for you.
Exactly. So you are getting still the health benefits out of what you're eating to fuel your body, because you still need all of the nutritional value that, you weren't necessarily aware of before.
Yeah, exactly. So if anyone out there is listening and you guys have a question about what do I do next, I'm interested. I've heard this. I've heard it on TikTok. I've looked at it on YouTube. I hear it in the magazines and I want to get started. Give us a call, 281-265-6565, or email us at info@everydayhealthhacker or info@meridianmd-dds.com, because we're here to take care of all of your medical and dental needs. And we look forward to new questions and things to talk about next time. And I want to thank
There will be more.
Natalie for all the phone calls and information. And she's just an education specialist extraordinaire. So if you have questions, please don't hesitate to reach out. And until then, Have a blessed day.
Yep.
And we'll see you
everyone
soon
later.
from Meridian Health Institute. Talk to you soon.
Bye.